Cerebral palsy can be due to genetic causes. Genetic causes can be due to chromosomal abnormalities too. And secondly, it can be due to perinatal causes. Perinatal, postnatal and prenatal causes. Prenatal causes can include even gestational diabetes it can include, and mother having epilepsy can manifest in this, and certain infections like rubella, mumps infections can also manifest. And during the labor, perinatal complications includes a hypoxic baby can lead to inadequate oxygen. Hypoxic baby due to inadequate oxygen supply can lead to damages. And postnatal also infection of a baby, different infections like encephalitis, meningitis also can lead to. Different infections later on after the birth can also lead to. Autism, it is a spectrum disorder where the neurodevelopment syndrome with polygenic heritability can be seen with a wide range of impairments. Okay, I repeat, it's a spectrum disorder with neurodevelopmental syndrome with polygenic heritability with a wide range of impairment, which is seen mainly in social and communication restricted repetitive behavior. And the spectrum disorder, what I have told, it can be of 4, that is autistic disorder, Asperger's disorder, childhood disintegrative disorder and Retti's disorder. As told earlier, in mental retardation, these children will also will find an delay in achieving their milestones. All their developmental milestones will be delayed. In some cases, it's of rare, but majority of the cases they show these developmental delays. Their speech and communication deficits will be prominent. There will be language delay will be present. There will be intellectual disability, irritability can be seen, and insomnia is a major feature that is seen, and hyperactivity in certain children, followed by hypoactivity can also be seen. Some children are always in the hypoactive state, and in certain children there will be precocious skills seen, like other than their peer groups. Precocious skills means when compared to their peer groups, they will be much more talented in certain things, like in remembering dates or in singing. They will show certain IQ, not IQ, but certain features, special features when compared with their peer groups. We have certain kids here, and as I told, there will be disturbances in their language development, and we can treat it by using at the earliest, if we diagnose it earlier, behavioral modifications can be made using different therapies. We have different therapy modifications done especially for autistic featured childs, depending upon which spectrum they are falling. Autism എന്ന് പറഞ്ഞ ഒരു ബിഹേവിയറൽ അബ്നോർമാലിറ്റിയും കൂടെ ആയിട്ടാണ് ക്ലാസിഫൈ ചെയ്തിരിക്കുന്നത്. അപ്പോൾ അതുകൊണ്ട് തന്നെ ബിഹേവിയറൽ തെറാപ്പി കൊടുക്കാൻ പറ്റും. സ്റ്റഡീസ് ആർ ഷോയിങ് ദർ ഈസ് മോസ്റ്റ് ഓഫ് ദി ഇഗ്നോറൻറ്റ് ചൈൽഡ്സ്, ലൈക്ക് നമ്മളൊരു അറ്റൻഷൻ കൊടുക്കാത്ത കുട്ടികളിലൊക്കെ ഒരു ഓട്ടിസ്റ്റിക് ഫീച്ചേഴ്സ് പ്രിഡോമിനൻ്റ് ആയിട്ട് കാണുന്നൊരു സ്റ്റഡീസ് ഒരു നോട്ട് പ്രൂവ്ഡ്. Down syndrome. Down syndrome is one of the most common chromosomal abnormality, which means trisomy 21. And the risk of a Down syndrome baby being born increases with the chances increases with the maternal age too. It's not particularly that, but as the age increases beyond 40, it is much more riskier to have a Down syndrome baby. There is no particular reason as such to say, but studies shows so. The common features includes intellectual disability associated with congenital heart diseases, congenital hypothyroidism, acute leukemia, and they will have certain physical features including a protruding tongue, round face, the typical features of the Down syndrome. The causes can be, as told earlier, antenatal causes, genetic causes, and postnatal too.